You have to check this story out. Melissa got mold jacked. Check it out. Dr. Peter Osborne here. Welcome to Moldy Mondays. Today's a PSA, and I want to warn you, this video contains very graphic images, so if you are weak of heart or tender of tummy, you might just want to click away now. But today's message is all about mold. If you are a woman and you have suffered with breast implant illness or suspect you might have it, that's what we're diving into. So I want to show you some things. This was research publication out of a journal. Infection is a serious complication of breast augmentation and tissue expansion with inflatable devices. Several reports have shown that fungi may be able to survive, colonize, and even cause infections in saline-filled devices. The mechanism of how they penetrate, spread, and colonize inside the inflatable implants is not exactly understood. Doesn't strike confidence for us in these surgeries. That being said, let's take a look at what's being found. So here's a case published in a surgical journal of a special type of fungal infection called Scedosporium. And you can see on these culture plates that little fuzzy growth. This is mold that they were culturing out of the implants of this 53-year-old woman who was pre-diabetic and in depression. And she was referred to a plastic surgery clinic for elective removal of her breast implants for persistent back and breast pain. So they cultured this out of her. Now, that's not all. We see much more as well in this case study. Again, very graphic images. This was a 39-year-old woman with a history of augmentation 20 years prior. She had unilateral breast swelling. You can see here on this side, and tenderness, erythema in the context of months of fatigue, unusual body odor. She had brain fog, inability to lose weight despite exercise, and a healthy diet. She underwent an implant removal and peri-implant capsulectomy. Upon entering the left breast capsule, which is what you see here, they had a purulent fluid. You can see it close in on that. We'll blow up that so you can see it. But that was what was coming out of her. And when they pulled the implants out, you can see here this white growth. That's mold growing on this woman. And in this particular case, this type of mold is Penicillium. So in her case, she had a surgical removal and a full recovery. But it was the cause of her breast implant illness. We have another case here, in this case a different kind of mold, something called Candida albicans infecting this woman. You can see here visual on the infection over the breast. Again, yeast overgrowth. You see, although there are numerous reports on fungal infections in other implanted medical devices, so it's not just breast implants that this can happen with, fungal infections in silicone gel breast implants are considered uncommon. We herein report a case in which a Candida albicans infection after breast implant replacement resulted in implant removal. The patient presented with symptoms of infection 30 days after her breast implant replacement occurred. Pull it out and she felt better. Then we have here this article. You see, during December 2000 through July 2001, black sediment was noted in saline-filled silicone breast implants of women who had undergone revision surgery at a facility. They found something called curvularia fungus, which was isolated from the implant saline. We have another study, the semi-permeability of silicone, a saline-filled breast implant with intraluminal and pericapsular aspergillus, that's a type of mold. Growth of fungi within the lumen of saline-filled implants has previously been demonstrated in laboratory studies. We report a case of Aspergillus flavus growth within and around a saline-filled breast implant that was inserted 18 months previously. So this is something we have multiple medical reports on. You can see in this case, this was a paper published and reported at the University of Tennessee Health Science Center on a dematiaceous mold in a breast implant caused by curvularia as well as cladosporium mold. And you can see this is the implant. You can see over here all the black growth on that aspect of the implant. So again, pulled this out of a woman. So the question mark becomes, how does this stuff happen? How do we get mold growing in implants? How do we have mold implant infections? Because many women are struggling today. Breast implant surgery is very common, and many women struggle with what's being called breast implant illness. So how many of you are struggling from this condition because mold? Again, the only way to know is to remove the implant and do a culture or see the mold growth on the implant itself. So how does this happen? I bring to your attention one of the potential mechanisms. So this was an ABC News report, how hospital mold can cause 6 patients to die. So there was, this was back in 2019. It was a hospital, what they believe happened that killed 6 patients. These were patients that were in the hospital, likely caused by the air handling systems that serve our operating rooms. They suspected there was mold growing in the air handling systems. Look, if you're in a surgery theater and you're getting a surgery and there's mold growing in the air conditioning system, that's a potential way that your implants could become infected as they're being placed in you. So you got to realize how many hospitals, how many surgical rooms are potentially contaminated with mold. How many of them have HVAC problems? How many of them have mold in the building? Well, the EPA states that 50%, at least 50% of homes and buildings in the United States are water damaged with the potential for mold. So if you're on the fence about breast implants, maybe this video helps you. If you are sick and you have breast implants and you've changed your diet and you eat well and you exercise and you try to do all the right things and you can't overcome your illness, this may be something you want to consider. And if you want to learn more about mold, come visit me at moldjack.com. Make sure you sign up there for our newsletter. We're posting all year about mold illness, mold-related illness, and how to avoid it.